everyone, in this video we are basically going to study about principle and procedure of infection control. So what is infection control? Infection control is basically a procedure by which we will try to reduce the spreading, transmission and acquisition of the infection. In which persons the infection can be increased, like if there is a patient which is autoimmune, there is a more chance of infection, or he might get like early infected due to any normal bacteria which the normal person is not infected. So there are different type of way the person can get infected. Even the healthcare provider is also get infected. So there are four basically areas where the infection spreads more, from person to person, basically from infected person to person, from infected person to the healthcare provider, from infected person to the normal public, as well as from staff to staff. So we need to basically prevent the infection by different means and measures. So there are various principles and the procedure to basically prevent the infection. So what is basically infection control? It is basically measure or practice by which we try to reduce the chances of infection. It involves various steps at different levels. It involves the step at the patient level, at the individual level, at the healthcare provider level as well. So firstly, what do you understand by infection control? It is basically conscious method or the step which is carried out to reduce the risk of infection. It involves a practical and evidence-based method in order to prevent the spread of infection as well as acquisition as well as transmission of the infection. So why it is important to basically study infection control as a healthcare professional? It has been found at the era of COVID-19, 18% of infection was spreaded due to the infection, due to the spread from the airborne as well as from the hospitals. So there is a need to basically study about the infection control and the measures which we use to basically reduce the chances of infection. In the normal life, we encounter various germs because our body is basically having different type of flora. That means every individual has specific bacteria on their body. So every individual is going to be like affected by different kind of infection in the normal life. But we have immunity, we try to basically cope up with these infections. But the individual who are weak or they are autoimmune or they are suffering from any disease, they are basically autoimmune. So their body is not able to cope up with these bacteria or the infection. So we need to basically identify the areas where there is a chance of infection spread, transmission, or we can say there is an increased risk of infection. So in the normal life as well, we encounter different germs, but body try to manage and save ourselves as if the person is healthy individual. But in case of patient, it will be difficult. So if the person is infected to a particular disease, it is basically difficult for the person to cope up with that infection. So it is particularly important for a healthcare provider or environment or the staff or the hospital to understand why infection control is important and how they have to manage the risk of infection, how they have to control the risk of infection at the different level. So we have to work on 10 basic principles in order to prevent and reduce the risk of infection. So basically, what are principles of infection control? There are basically 10 major principles of infection control. Apart from them as well, there are also different type of infection control principle. Basically, we have to follow different set of precautions, rules, regulation. If we are working in a healthcare basically setup like hospitals, clinic, or even the normal staff areas. Then if you talk about principle of infection, it involves basically four things. It is basically critical component of healthcare system. If you talk about a hospital, clinic, or anything which is basically involving the healthcare professionals. Infection control basically provide a comprehensive framework to all the person which are basically working on that healthcare area, whether there is a housekeeping staff, nurses, the lab staffs or the assistant staffs. They need to basically know why there are basically different chances of getting infection from the person who is infected as well as from the flora of the hospital. Different hospital have different type of flora. Every hospital is specific to a specific kind of bacteria in their environment. So even if a person is like transferring from one hospital to the other hospital, he might take the flora of that hospital to the other hospital. So there is chance of spread of infection if the patient is also shifted from one hospital to the other hospital. So principle basically provide the comprehensive framework how to manage and how to work on the infection control. These principles basically advise the healthcare workers, patient, even the general public, how they can reduce the chance of infection as well as provide the safety to the patient and reduce the risk of spread. Next, these principles basically if effectively implemented, then the 90% there are chances that the infection could be controlled. So it requires basically assessment. Firstly, we need to assess the area which is like requiring more of our effort in order to prevent the infection. Then it involves the method which we need to use. For example, if there is a patient who is suffering from TB, then the spread of infection could be from the like enteric route, even from the cough, sneeze, airborne infection could be there. So in that case, we have to use the rules which are going to protect us from that airborne infection. Like we need to wear the mask, we need to wear the eye goggles, we need to wear the gloves while contacting with the patient. So these principles are going to basically provide us a comprehensive framework, as well as if they are implemented in a good manner, then there are chances that the infection spread could be controlled. First and foremost thing is the hand hygiene. It is the first and the basic principle of the infection control. What do you understand by hand hygiene? It is very simple, but it is the backbone of basically preventing the infection or the spread of infection. So we can say it is basically the important backbone of the infection control. You can wash your hand with the plain water, antiseptics, even there are scrubs which are available in the hospital for different procedure. Like if the person is going in the OT room, they need to basically wash their hand with the specific soap or the antiseptics. So there are different type of chemicals which are available in order to basically clean their hand. They could be like bacteriostate, there could be like bacterial killer as well as. So alcohol based hand rubs can be used in the hospital and the hospital settings. There are 5 key components which was provided by WHO that when you have to wash your hand. So whenever you are going towards the patient, before in coming in contact with the patient, you need to wash your hand. So there are 5 things which you need to keep in the mind. These are basically things which are going to tell you that at what places you have to wash your hand. First, before touching a patient. Next, before performing any procedure, like if you are bandaging the patient or anything else. After bodily fluid exposure to the patient, like if you have taken the blood sample, or if you have taken the any serous sample or anything, like if you have given the suctioning or you have taken the sputum for the culture or anything else. So if you have taken even the sample, then also before performing the taking the sample, you have to basically go for the hand hygiene. Next, after touching the patient, you have to go for the hand hygiene. Next, if you are touching the patient surrounding areas or the things which patient is touching, then also you need to go for the hand hygiene. So this is the first foremost principle of the infection control. Now next is the PEP, that is personal protective equipment. These are basically the equipment which are designed for the healthcare professionals or the person who is basically coming in contact with the person who is infected, to basically reduce the risk of spread to the person as well as the person who is going to like coming in contact with the infected person. It involves the use of gloves, mask, eye goggle, and there is a gown which person has to wear. So there are like full PEP kits are also available, and this was basically prevalence of the PEP was more after the COVID era. So we can see these are basically the equipment which are worn by the healthcare professional or the doctors or the teams or even the person who is coming in contact with the patient, whether it is the normal public, for the preventing the contact of pathogenic bacteria or the infectious thing to the person. It includes gloves, mask, gown, respirators, face shield as well as eye protections. So when you have to use the PEP kits, firstly whenever you are going to be like in contact with the patient, if you are performing any procedure if you are performing any procedure with the patient, like if you are like taking assessment, even if you are taking the sampling, if you are giving the chest PT, if you are even giving the medication, if you are measuring the blood pressure. So these are the things you have to like keep in your mind before going to the patient. If the person is like at high risk of infection or the high risk of spread, in that patient you have to basically wear the PEP kits. It was like in case of COVID era, the patient the chances of infection was very much high. So at even every visit the doctor used to wear the PEP kits. So whenever the healthcare workers are but first and foremost thing is the hand hygiene. It is the first and the basic principle of the infection control. What do you understand by hand hygiene? It is very simple, but it is the backbone of basically preventing the infection or the spread of infection. So we can say it is basically the important backbone of the infection control. You can wash your hand with the plain water, antiseptics. Even there are scrubs which are available in the hospital for different procedure. Like if the person is going in the OT room, they need to basically wash their hand with the specific soap or the antiseptics. So there are different type of chemicals which are available in order to basically clean their hand. They could be like bacteriostate, they could be like bacterial killer as well as. So alcohol based hand rubs can be used in the hospital and the hospital settings. There are 5 key components which was provided by WHO that when you have to wash your hand. So whenever you are going towards the patient, before in coming in contact with the patient, you need to wash your hand. So there are 5 things which you need to keep in the mind. These are basically things which are going to tell you that at what places you have to wash your hand. First, before touching a patient. Next, before performing any procedure, like if you are bandaging the patient or anything else. After bodily fluid exposure to the patient, like if you have taken the blood sample or if you have taken the any serous sample or anything, like if you have given the suctioning or you have taken the sputum for the culture or anything else. So if you have taken even the sample, then also before performing the taking the sample, you have to basically go for the hand hygiene. Next, after touching the patient, you have to go for the hand hygiene. Next, if you are touching the patient's surrounding areas or the things which patient is touching, then also you need to go for the hand hygiene. So this is the first foremost principle of the infection control. Now next is the PEP, that is personal protective equipment. These are basically the equipment which are designed for the healthcare professionals or the person who is basically coming in contact with the person who is infected, to basically reduce the risk of spread to the person as well as the person who is going to like coming in contact with the infected person. It involves the use of gloves, mask, eye goggle, and there is a gown which person has to wear. So there are like full PEP kits are also available, and this was basically prevalence of the PEP was more after the COVID era. So we can see these are basically the equipment which are worn by the healthcare professional or the doctors or the teams or even the person who is coming in contact with the patient, whether it is the normal public, for the preventing the contact of pathogenic bacteria or the infectious thing to the person. It includes gloves, mask, gown, respirators, face shield as well as eye protections. So when you have to use the PEP kits, firstly whenever you are going to be like in contact with the patient, if you are performing any procedure if you are performing any procedure with the patient, like if you are like taking assessment, even if you are taking the sampling, if you are giving the chest PT, if you are even giving the medication, if you are measuring the blood pressure. So these are the things you have to like keep in your mind before going to the patient. If the person is like at high risk of infection or the high risk of spread, in that patient you have to basically wear the PEP kits. It was like in case of COVID era, the patient the chances of infection was very much high, so at even every visit the doctor used to wear the PEP kits. Whenever a healthcare professional is going to work with the area which is at high risk of infection, even if the person is working in the lab, he is dealing with the samples which are infectious sputum, infectious blood sample, even the infectious sample areas, then the person has to be more conscious and they has to go for the PEP kits, or they have to wear these equipments in order to prevent the contact with the pathogenic bacteria or the infectious material. So it basically includes different equipments, as I have told you. Then after wearing the PEP kit, we have to go for few steps. We have to basically consciously go for few steps, like we have to avoid touching maximum surfaces, avoid touching the area which are like don't require to be touched. Try to reduce the maximum contact with the infected material. Remove the PEP kit as soon as its use has been like not needed. If you observe after removing the PEP kit, you have to go for like washing your hands or go for the hand hygiene. Then PEP kit should be checked and should be like their disposition should be managed in proper way. Like gloves should be thrown in the different area or the different container. Mask should be thrown in the different container. So you have to also go for these things because this can also lead to the spread, not to the patient but to the staff who is like working around you. Now third principle is the environmental infection control. That means the area in which the person is working, the patient area basically need to be consciously monitored every time. It should be cleaned every time. The housekeeping staff should work in a particular time interval to basically go for cleaning, for disinfection of the material which is used by the patient. So in the infection control, environmental safety, environmental protection is also very important, not for the patient but for the individual who is working in the healthcare area as well. So it involves the healthcare worker who can ensure the hospital area should be cleaned every time. Housekeeping staff is the main basically workers in the environmental safety area. They should be like having a regular interval to clean the area in which the patient is there, the normal lawn area, the area where the persons is sitting, like the family members are sitting because they are in continuous contact with the patient. So the reusable equipment should be basically clean or disinfected, or you can say autoclaved every time, because they need to be used again. So if they are came in contact with the patient who was infected, for example, if you have used the stethoscope on the person who was infected with TB or any severe infection, so in that case you have to basically go for sterilization of that equipment. Now, fourth principle is the respiratory hygiene. Like if you suppose you are coming in contact with the patient who is suffering from the respiratory disorders, they are having like increased amount of sputum, they are having increased amount of cough, sneezing, something like that. So mostly the respiratory infections are airborne and there is an increased risk of like spreading of the infection. So in that case you have to go for respiratory hygiene. For that you need to wear the mask. If the infection is very much at higher risk of getting spread, in that case you have to also wear the respirators. So appropriate respiratory practice should be done to reduce the risk of respiratory infections, or to basically prevent the influenza, COVID, because they all were the respiratory infections. They were basically spreading because of the airborne, or you can say the activities like sneezing, coughing and all. So you must follow following habits in order to prevent the infection spread, as well as go for the respiratory hygiene. Firstly cover your nose, mouth with the disposable tissue while coughing, sneezing. It is for the patient who is infected. For the staff, you need to wear the mask. For the high risk patient, you need to wear the respirators. So the mask should be offered to the person who is like coming in contact with the patient, whether it is a family member or if any healthcare professional is there. Also wear the mask in public areas. If you are like working in the healthcare areas, you are going out, in that case as well you need to wear the mask. Everybody knows that after the COVID era, it was very common in the normal public as well to wear the mask. Now next is the fifth principle, that is immunization. There are different type of infections which are if the person is getting infected once, then the next time there is less chances of the infection. The person has ability to cope up with that infection. For example, if you had chicken pox and you are able to cope up with that infection and you are survived and you are now well, you have basically now generated the antibodies against that infection. So in the next case, if the same infection is going to affect you, in that time your memory cells or some specific cells, B cell, T cells which are present in the blood, are going to basically recognize that infection, that bacteria and that virus. In that case they will generate the same antibody they have generated in the first encounter. So your body is again going to be coping up with that infection. So there are less chances that you will be having the severe symptoms or the illness because of the infection that had occurred second times. So immunization is very important. There are two types of immunization, active and the passive immunization. In some cases, like if a child is born, there were various kind of infections like polio, which was very common, you can say 20-30 years back, but now there are very less chances that the person is going to have polio, because it is all possible because of immunization. In that case, we basically give the weak virus or the killed bacteria or the killed virus to a baby at some interval for the different diseases, even for the TB, even for the we get BPV vaccine for polio. Salk vaccine. So these all are going to like make the person immunity more stronger, because when the immunization is going to give weak virus or the weak bacteria to the person's body, the body is going to cope up with that bacterial infection or the virus and try to generate the antibodies. Once if the antibodies are generated, the body will be having like power to again, if the infection is coming again, the body will be having power to fight that infection again. So immunization play very important role. If you are working in the hospital, there are like you are using different type of materials, iron materials, steel materials in the OT areas that has been came in contact with the patient, as well as if you get some minor cuts or something like that, there are more chances of getting tetanus or the infection. So at a specific interval, like at interval of 3 months, you must have immunization or get vaccinated for the tetanus as well as for the chicken pox before working in the hospital. Or you can say there are rules in the different hospital area. If you are going to like work on that area, you have to go for the immunization for the different kind of viruses and bacteria. So it basically play very important role to prevent the spread of infection as well as to generate the immunity in the body. It is not for only the workers who are working in the hospital, it is for the normal public as well. So whenever a child is born, it is government's rules and regulation that the child should undergo for vaccination at the different interval of time for the different type of bacteria and viral infections. Now next is safe injection practice. If you talk about safe injection practice, that means like if a patient is having any procedure, like if you are taking the sample, or if even if you are giving the medication via injection IV, whether it is IM or any route you are giving the medication to the patient, in that case also you have to go for safe practice. That means you must avoid anything, any infection that can spread. For example, you should not use the same syringe from one patient to the other patient. So there are like different rules and regulation while performing the activity of injection. So you must use the sterile syringe, and you throw it at the specific container which is for infected material, and do not use the same syringe for the next sampling as well as for the second person or the second patient. So there are basically specific guideline to use the injections. First of all, you need to avoid the injecting area which is like infected. For example, if there is a wound which is open wound or infected area, so directly it is like said, no need to go for injection at the infected area. Next, you always use the sterile needles for injecting the person, whether if you are taking the sample or if you are giving the medication. Next, always go for, don't use the same syringe on one person or even the same person, or if you are like using the syringe on one person and then the other person, don't go for that as well. Avoid inserting the syringe which have used for sampling for giving the medication against. Okay, so just remember these things. Always wear the gloves while giving the injection or you while taking the sampling with the injection. So these are some guidelines that you need to follow while injecting the patient. And the disposition of the injection needles is very important. Like there are different type of containers which are available in the different areas of the hospital, and you must have knowledge of biodegradable waste management, because these like particles or the equipments which you are using in the hospital, they are disposed in the different manners. So the needle of the syringe which you have used in the patient should be disposed in the infected container, which is basically for keeping the infected material. Now next is the safe management equipment. All the equipment that you are using with the patient, if the patient is like using any container, any glass, or like if the patient is performing the spirometry, the devices which are used by patient should be sterile every day, or you can say at a specific interval. The devices like BP curves or the OT area devices like you can say hammer, plates, these should be sterile or autoclave in order to kill the bacteria. You can also go for the use of disinfectant. Basically these are liquid chemicals which kill the bacteria from the surface area. So these basically steps we have to follow in the hospital for cleaning the environment or the equipment. So before like cleaning or go for the like which type of equipment is required, which type of cleaning, you must also know that if whether this equipment is going to cause the more hazardous thing or not, whether this equipment required proper disposition, whether this if equipment is safe to dispose in the specific container or not. So these management technique you should be knowing before basically disposing any equipment that you have used with the patient. Now next is the eighth principle, that is clinical waste management. As I have told you, all the equipments that you are using with the patient should be managed properly. So there is a specific biodegradable waste management procedure, rules and guidelines that you have to follow. You have seen in the hospital red box, white box, yellow box. These are all are basically used for different purpose. Like if you have wear the gloves, for disposing the gloves you need to go for the red container, or you have to throw that gloves in the red container. Similarly, all these container have different specific role in disposing the different items. Now ninth is placement and the assessment. That means when you are going to be like in contact with the patient for assessment, for even placing anything like for bandaging, for any activity, in that case also you have to be consciously control and try to reduce the risk of infection. So before performing any activity, for any assessment, for anything or any procedure, you need to be consciously do all the activities. If you are taking the BP measurement, try to use the gloves. If you are taking the sample, try to use the gloves. If you are taking even the history, try to reduce the contact with the surface which the patient is there, like his table, his sitting area, and try to like talk with the patient at some distance. Now 10th principle is education and training. That is the main and foremost principle for even everything, whether for infection control, for the disease management. Patient education is very important, because until and unless patient is not knowing anything whether the disease he is suffering from is infectious or communicable or not, he might may come with the contact with the family member. So in that case the patient must be educated whether the disease he is suffering from is communicable or not, whether it can spread from airborne, from food, or from which type of contact. So patient education is very important. He must be knowing the equipment he is using should be like sterile by his also. He must be given like disinfectant, or you can say any type of scrubs, hand scrub for touching his own material, like if he is using any plate or if he is using spirometer as well, then he must clean the spirometer mouth area with any disinfectant before keeping it after the respiratory exercises. So this patient education has very important role, because patient must have to be consciously controlled and try to reduce the risk of infection to the person who is coming in contact with him, whether it is family member or any other healthcare professional. So thank you. These are basically the procedure and principle of the infection control. Following these principle can implement, after implementing these principle, or you can say following these principle, can reduce the chances of infection by 80 to 60%. So you must be aware of all the management, biodegradable waste management, use of proper PP kits, use of hand hygiene, and the methods of proper hand hygiene in order to reduce the infection spread, transmission, as well as acquisition of the infection.